agencies. With over 15 years with the American Veterinary Medical Association, Dr. Scarf oversaw aquatic veterinary issues. He continues to consult with numerous veterinary organizations and governmental agencies in several countries on veterinary education and legislative and international and regulatory animal health issues. Dr. Scarf's current endeavors primarily involve assisting international organizations and veterinary schools in North and Central America, Europe, Africa, and Asia. Dr. Scarf is currently an extraordinary professor at the University of Pretoria, Faculty of Veterinary Science, and serves as the Associate Director for the Aquatic Veterinary Education and Biosecurity at Tetratlech, Ludwig Maximilians University, Munich. Forgive me if I couldn't mention the name very well. As CEO of the Aquatic Veterinary Associates International, he also oversees veterinarians in several countries who provide services to aquaculture producers and industries throughout the world. As a USDA APHIS veterinary medical officer with the U.S. National Animal Health Response Corps, he has assisted with responses to outbreaks of important foreign animal disease outbreaks in the U.S. He has served as the treasurer, secretary, president, and parliamentarian of the World Aquatic Veterinarian Medical Association, chaired the WAVMA credentialing committee that evaluates the one competency of aquatic veterinarians and is recognized as a WAVMA Distinguished Fellow for his contribution to advancing aquatic veterinary. Wow, this is a lot of experience we have on board here today. With him is Professor Dr. Dusan Palic. Professor Palic comes from a long line of veterinarians and educators. Being the third generation professor of veterinarian medicine, he received DVM and MVSc degrees from Faculty of Veterinary Medicine in Belgrade, Serbia, and PhD from Iowa State University College of Veterinary Medicine, where he worked with CFSPH Jim Roth as assistant professor until he accepted invitation to LMU Munich and took over the chair for fish disease in 2012. Dusan is a founding member, certified aquatic veterinarian, and past president of World Aquatic Veterinary Medical Association. He's a founding diplomat and former vice president of European College of Aquatic Animal Health and the director of the International Aquatic Veterinary Biosecurity Consortium. As senior expert in aquatic animal health for Food and Agriculture Organizations of United Nations, Prof. Palic has spent significant time in the Kingdom of Saudi Arabia, working on preparation of the National Aquatic Animal Health Strategy and Action Plan for the Kingdom of Saudi Arabia. Dusan was a representative of the academia and organized aquatic veterinary profession in the FishMed Plus coalition that was established by Federation of Veterinarians of Europe upon request from European Medicine Agency, with a goal to improve access and availability of veterinary medical products, including vaccines, to the EU aquaculture industry. He's an expert member in WG3 Farm Management for preparation of Partnership for Animal Health and Welfare for Horizon Europe. Currently, he is an aquaculture expert on World Veterinary Association project for the development of essential medicines list. As world aquaculture is steadily growing and overtaking terrestrial protein production, it is becoming clear that substantial and safe use of water resources must be achieved to support the global goals and provide safe and affordable food for increased human population. I present to you Dr. Professor David and then Professor Dusan. But before we move on to hear them, I want to put in place a few house rules. Please, all questions should be posted to the Q&A feature on this particular platform. The Q&A feature can be found at the bottom of the screen, you would have the Q&A and then the chat features available to you. So we are using the Q&A only for the questions. And also in terms of the chat, you can use the chat room to introduce yourself, let us know who you are, where you are coming from, and which organization you work with. So we use the chat for that purpose, and then the Q&A only for questions and then answers. Without much ado, I think I would quickly move on to give the platform to our able experts in veterinary medicine and, for that matter, biosecurity principles in aquaculture. Professor David and Professor Dusan, please, you have the floor. Thank you very much.
Thank you so much, Dr. Dudu. I'm very happy to be here. This is Dusan Palic speaking from Munich. And I would also hear that Professor Scaff from Chicago. So we have quite an international group here. I see from the chat function that there is several colleagues from different parts of the world also joining. And in our names, we're really happy to participate or to lead this webinar. And we are very thankful for the invitation by the Chamber of Aquaculture Ghana to start this. We have about 2 hours to go through quite a lot of things today. And one of our first and foremost intentions is to provide you with information that could lead to further collaboration and attempts to do some in-person visits and in-person training that is, in our opinion, really necessary to fully understand how this process of practical disease prevention, control, and eradication at the farm works when we talk about biosecurity principles in aquaculture. These topics we did for quite some time now, and Dr. Scarf will tell a little more about that later. But I would like to go on with a brief introduction on the problem that we may have today, how to meet international standards and national animal health regulations in the very fast changing world. So I will talk a little bit of why is biosecurity important. We will mention which are the important international or OIE standards, how the IVBC or the International Aquatic Veterinary Biosecurity Consortium has evolved over the years. And then we'll go into more detail about how do we do it. So it's not about talking to people, it's about, or at people, it's about the dialogue that we would like to have. So questions are encouraged. Please use the Q&A section for questions, and our hosts will be presenting those questions to us, even if they interrupt us. That's definitely okay. So please get your questions in there, and we will do our best to answer them. We will try to finish the presentation today on what may be needed to implement the aquaculture biosecurity in Ghana, but also we are discussing this on more global level as well. So I see that colleagues from different countries in Africa have been joining, and we will try to address this topic about how to implement aquaculture biosecurity that's also relevant to other countries. But why we want to emphasize aquaculture biosecurity as one of the key points in strategy to be able to support the aquaculture industry. I will go through a set of examples and some information that some of you may already know, but it is important to figure out where the aquaculture is going and what are the main problems in aquaculture before we really start talking about the biosecurity principles. globally, looking at about 50% of seafood that we eat as species, as human beings, is currently farmed. And also, aquaculture is required to support wild fish stocks that come from the wild catch. At the same time, demand for animal protein is set to be doubled by year 2050, and that is pretty much only less than 30 years away. So it's less than a full generation of people that will come in 30 years and still need a lot of food and protein. And the African continent is one that will feel quite a lot of this pressure for increasing the protein demand. With that being said, farm fish is one of the most resource efficient animal proteins on the planet. It has very low feed conversion ratio. It has low use of fresh water. It has relatively low carbon footprint, or one of the lowest ones in the agriculture industry. Compared to poultry, to pork or swine, to cattle, aquaculture is probably the way to go if we want to meet these protein demands globally. Back in 2009, so about 11 years ago, current president of the OIE predicted or shared the predictions that by 2050, half of the animal protein consumed by people will come from aquaculture. And from the assistant director of the FAO, our colleague Ernie Mathiasen, the sentence that says that by 2050, about 100% more food production would be needed to feed close to 10 billion people. With those two things in mind, we have come up with this global animal protein production example that right now, actually, these farmed fisheries are at the level of about 91 tons, while capture fisheries is less, it's about 89 tons. So last year, actually 2019, last year we don't have really numbers because the corona is making it a little bit more difficult for everyone to do collection of data and statistics. But in 2019, farmed fisheries for the first time were above capture fisheries in amount of protein produced. And this is visible also on the right-hand side of the slide, how the aquaculture growth is expected to continue until year 2050, or at least we hope to grow that far and that much. However, in relatively recent survey about 5 years ago, the Global Aquaculture Alliance, or Global Alliance for Aquaculture, had different types of survey that was asking aquaculture industry where they see the problems for sustaining the growth of the industry that is supposed to be so important in feeding the world. And diseases were really probably the first, the most extremely important problem. Also, the third in line was disease-free broodstock problem. So taking all the other problems into account, diseases and disease-free broodstocks has been identified as a major sustainability problem, the most important one in this survey. Coming now from the perspective of everybody else, so not just the producers, we have basically set of common aims, common goals that we have to have for principles of biosecurity to be applied to very practical and down-to-earth level. So we're talking about the producers, we're talking about the government, including veterinary services, and we're talking about the international non-governmental organizations such as the World Bank or the OIE or the World Trade Association. We all have one big reason in common, and that is to do a production that is as financially viable as possible. Producers want to maximize the production. They want to add value to their products with certifications. They want to protect their investments. On government side, governments want to protect those industries, increase production and trade, because that is the source of revenue, of course, money. But also they want to meet the regulations and standards that are posed by the international bodies of standard setting, such as the OIE, or the World Association for Animal Health. Their goal, on the other hand, is to keep the trade going by prevention of disease spread, to protect, again, industries at much broader level, and to meet those trade requirements, specifically the SPSS agreement, the sanitary and phytosanitary agreement of World Trade Association that most of the countries have signed on. And this is where our story comes to example points. There is a good reason why aquaculture industry has identified diseases as their #1 problem. It's because direct losses from aquatic animal diseases in different pandemic outbreaks have been summing up to the amount of expenses that are comparable to the foot and mouth outbreak in the UK a few years back, 20 years back, also comparable to original SARS coronavirus infection that was happening back in the 2000 decade. Aquatic diseases taken globally have been taking the really expensive toll on the industry in the last several decades. And one of the ways to approach this problem is that we have tried using several venues. We have tried combining the expertise of multiple stakeholders to come up with this IVBC approach that I would like to invite Dr. Scarf to talk more about, as he was the pivotal figure in setting up and working on the IVBC approach. Dave, can you please take over?
Yes, thank you, Dusan, and thank you to all the people that are present. Thank you for the invitation to at least give us some ideas. What I'm going to cover now is what started us thinking about how to not only prevent, but also control and also eradicate infectious diseases in aquaculture. I will say that what we are going to outline, we discovered really can apply to almost any types of things. And if you look at, or you think about, how do we actually eradicate a disease? Is this feasible? I think what we have found here is, if you look back at the 2 diseases that we have eradicated from the world, smallpox and rinderpest, actually contain all of these issues. This is what we sort of discovered after we put things together. So what I'm going to do here is to give you some of the evolution and history of how this thinking evolved. I'll say that it actually started somewhere around 2002 when we got together and got experts together in a variety of meetings. But equally important, how it actually links directly to what the OIE has laid out in the Aquatic Animal Health Code and Manual, and other organizations such as FAO have sort of started now looking at this. If you can give us the next slide, Dusan. Just briefly, as I've said, it's taken us 15, perhaps more than that, certainly starting about 2003, in which we brought together a number of people. I'm not going to elaborate too much on this, but you see on the right-hand side a whole series of organization, and that we started collaborating, and eventually evolved into this consortium. I'm not going to elaborate on too much unless anybody wants to know who are the formal members of the consortium. But the effective part of this is, number one, we put out a number of publications. We will give you a reading list at the end of this for anybody that wants to read some more. We have published books, journal articles, manuals, all sorts of things. And we've also, importantly, tested these in numerous countries, not only Norway and Chile. What's important there is Chile, for example. We moved a small team down to advise Senapasca how to manage and work with and implement biosecurity programs at the height of the infectious salmon anemia program, and certainly some of the things that they've put. We've also focused on other countries such as South Africa. We've done several workshops in North America and in Asia. And if we can have the next slide. What we came up with is over time, and these really are evolved, that while other people started talking about biosecurity, and really what they were focusing on is just quarantine hygienic practices, there was a lot more involved in this. And so some of the principles that we established early is that it has to be evidence-based, and it has to have very clear endpoints. In other words, you've got really simple, clear objectives. Why are you putting this in? It has to be standardized and scientifically sound, and certainly it has to be justifiable. Justifiable in numerous ways, and we'll get into that later. But it has to also, or it can, include prevention, control, and eradication. Our focus really is on infectious diseases that can be transmitted easily. It has to, because ultimately it always comes back to regulatory requirements, but those need to be from the local level to the international level. Otherwise, trade and various things are not going to work. It's also, particularly from the producers, got to provide business continuity. In other words, systems that are in place need to be able to continue if a catastrophe happens. And you can relate this to what all of the international things that are happening with COVID-19 right now. Keep that in mind as we go through here. And there have to be incentives and rewards for all stakeholders, and that includes the producer and the governments and and I'm going to call them the veterinary workforce. And the veterinary workforce not only includes veterinarians, but paraveterinarians, the diagnostic labs, and so on. There are some critical features that we developed that everything is focused on. I've already said prevention, control, and eradication. You'll find this will work with any type of disease or any type of operation, business continuity, and we've leaned very heavily on the international standards that are in the OIE code and manual. And I will say, because all countries, or almost all countries, are signatories and have to agree on those standards that are implemented in the code and manual, this actually sets the basis for national regulations. So what we're going to do here is we're going to give you some examples to illustrate not only these concepts, but how they can be applied. The next slide. Okay, so to reinforce, and we will come back to this, there are several critical things. The first is that you've got to identify what the disease hazards are and the risks for any type of what we'll get to is an epidemiological unit, and I'll explain what those are. We've got to look at critical control points where the disease can get in or escape. And we've got to have a plan for mitigating actions on those critical points. In other words, if you don't prepare for the eventuality of any disease, and these don't have to be regulated diseases, they can be anything. to be able to plan for contingencies if you get this likelihood of you getting into a disastrous situation is very important. But you've also got to determine at any point in time what the disease status is of this epidemiological unit. Think about this as a farm, and actually move to somehow describing that it is actually free. So it's going to require monitoring and auditing of the situations. And I think here comes the important part, that to be able to certify either levels of biosecurity or disease freedom is the effective endpoint that we are all looking for. I won't mention it too many times, but I emphasize here for documenting biosecurity plans in a written biosecurity thing, and to maintain written records. If you can provide us with the next slide. Okay, we've mentioned, and we had a hard time really coming up with this. At what level can we apply the principles? Underlying everything is this epidemiological unit, okay? And that really is the ultimate focus of that. And whether this unit is diseased or infected, and hopefully remains that way, okay? I think the next slide, Dushan, sort of explains this a little bit better, okay? It refers back to how the OIE defines an epidemiological unit. Think about this as a population of animals that is separated one way or another from other populations of the same animals, and a situation in which infectious or contagious diseases can be transmitted from one to the other. In the parlance of the OIE, we're looking at an establishment, which effectively, think about this as a farm, and I'll illustrate that on the just a picture. This is a hypothetical that actually is a poultry operation, but it can equally apply to aquaculture. A compartment in which there may be several farms that all have the same, I'm going to refer to this as the biosecurity activities in place. And this might apply to something else. It might also apply to a zone in a country, a region, or the whole country. And I use as an example here, the second box, which actually zones Patagonia, in which the US, Patagonia, Argentina, and also the OIE recognize different zones which are geographically separated from other zones, for instance, by mountains or some other artificial separation point, to protect against foot and mouth disease. So it has been applied. And then you apply that to countries, the third small thing, and each country it can apply to. If we can have the next slide. What we have eventually did is try to put this into a meaningful flow chart of all of these different things that need to be encompassed. And we've ended up with, I think, 9, you can think of them as steps. We will go through all of these things one by one to give you an idea. But the key features here is on the right-hand side, or the left-hand side. You may not be able to read this now, but we will illustrate it with better graphics. What the average farmer might ask, or the man on the street, in terms of that. The center yellow boxes are the actual processes and names that we've got to it. And you'll notice in every case on the right-hand side, all of these need to be documented, and documented in an aquaculture plan and in, let's say, the farm records, because we have to have effectively evidence that certain things have been applied. And again, I emphasize, these are epidemiological units. They can be a farm itself. It can be parts of a farm, such as different ponds on a single farm, or even different tanks on a farm. The whole farm, it could be multiple farms in a region or zone within a country, and it could be the whole country. And we'll get to some of that later. You can have the next slide. We will point out, although OIE has taken the lead, and we'll illustrate a new chapter that actually addresses what needs to be put in on the farm, FAO has also been instrumental on this, and they've outlined a process, and this is mainly at a large national level or a policy level, in which they see various things need to be instituted. And to some degree, this fits in with the whole progressive approach to first looking at an individual farm or multiple farms using the same approach and expanding that until we get to the country level. FAO's major thrust here is obviously trying to get the countries to follow a sequence of steps that will ultimately lead, hopefully, to the country being identified as free of whatever disease the focus is of the biosecurity. So if we can look at the next slide. This is a brief 4-minute presentation that OIE has put together to really give you some introductions to the OIE code and manual. And Dushan, if you could start that, I'd appreciate it.
The Aquatic Animal Health Code and Manual gather the OIE international standards. They aim at improving aquatic animal health and welfare of farmed fish worldwide. The implementation of these standards also ensures safe international trade in aquatic animals and their products. The Aquatic Code defines general measures and systems to set up for early detection, notification and control of pathogens in aquatic animals and their products, and preventing their spread across borders. Key topics include quality of aquatic animal health services, aquatic animal disease prevention, surveillance and control, aquatic animal disease notification, import risk analysis, international veterinary certification, trade measures and procedures, prudent use of antimicrobial agents in aquatic animals, and welfare of farmed fish. The code also includes disease-specific chapters designed to prevent pathogen introduction in importing countries. The nature and risk reduction measures applicable to the traded commodity are taken into account, as well as the aquatic animal health status of the exporting country, zone or compartment. These diseases of global concern are regularly updated and make up the OIE list of aquatic animal diseases. The companion volume of the Aquatic Code is the Aquatic Manual. Divided in 3 parts, the manual provides internationally agreed recommendations to support effective laboratory testing capability and specific methods for disease diagnosis. These requirements are listed by specific disease. It also presents the network of OIE reference laboratories, offering diagnostic services to countries and collaborating centres designated by the OIE as Centres of Excellence. The OIE international standards included in the terrestrial and aquatic codes and manuals are adopted by all the OIE member countries and regularly updated. It is by integrating them in national legislation that members can improve the performance of their animal health systems, meet their WTO obligations, and ensure safe trade in aquatic animals and their products. OIE, protecting animals, preserving our future.
Thank you, Dushan. If you can give us the next slide. There are numerous chapters that directly apply to aquatics biosecurity. Without going through all of the chapters, I've given everybody a link at the bottom here that one can actually look through all of these chapters after you realize the different pieces that we'll go through in the biosecurity plans. And I think one of the most important things that has helped, if one reads all of these chapters, sometimes the average person gets confused about what it is. It's difficult to understand. It is a problem in saying, okay, what my country has agreed to in these standards, well, how do I implement them? And so our program here effectively outlines we believe in common sense approaches that can fairly easily be implemented, the system. Now, what is important is prior to this year, OIE really only applied or addressed what they call basic biosecurity without any intention, without any indication of, well, how do you apply all these things? It was very difficult for people to understand. And let's try the next slide. In 2012, at the May virtual National Assembly, where all countries sit down and vote on a motion to adopt a new chapter in either the terrestrial code and manual or the aquatic codes and manual. After going through several years within the aquatic animal group that actually works for OIE to look at the details of new chapters, get comments back from countries as to early drafts. This chapter, which is really chapter 4.1, biosecurity for aquaculture establishments, understand that establishments, in our case here, refers to farms, actually outlines all of this. Now, we're not going to go through the details of this, but the exciting part for us was in this chapter, almost every single one of the steps that we'll go through and explain have been put into formal language within this chapter. So what it did for us was really reinforce what we had spent 15 or 20 years with experts around the world coming together to look at the principles and how could you do it. It reinforced in us that we are actually on the right track, and this is a good way. So what we're going to do now is to try and illustrate to you the clear issues or the steps that any country or farm can take. I'm not going to spend a lot of time on the definitions, but I do want to encourage you to look at the glossary in the OIE code and manual and look at these definitions, okay? And some of them have been refined with the adoption of the new chapter, but essentially looking at management measures to reduce risks of either establishing or spreading infectious disease. The biosecurity plan, we will reinforce over and over again that you need to write those things down. You need to plan it out, how you're going to approach it and what you're going to do. And you need to document all of the stuff that you do to meet those objectives. We can have the next slide, which is just simply some basic biosecurity conditions. A lot of this now begins to apply to the country and filter down to the producers. You're looking at focused diseases, clearly for OIE's purposes, for particular diseases that you can look in the code for. It's going to require notification, and which is an important part, directly to the government agency that has authority over animal diseases. And it's going to have a surveillance system. You need to be able to watch for those, particularly to prevent the spread. But I agree will say that also, such that you can put in the contingency plans to prevent spread. We can have the next slide. We put this together in a flowchart. And again, this is reinforcing what's there, and we will go through all of these steps to illustrate how they could be applied. If we can have the next slide. Okay, I'm going to rest for a while and let Dushan carry some of these concepts. I'll let him illustrate, but we do encourage people to put questions in the Q&A, and if we can answer them during this, Dr. Duhu, we cannot obviously interrupt us, and we'll try and answer any critical questions now, or we'll bring those up during the Q&A session. Dusan, over to you.
Yes, hello, Dusan. Please, you are muted. Hello, Dusan. Please kindly unmute and then you can continue.
If we've lost Dushan, I can certainly continue.
Okay.
All right, let me start, and if we get Dushan back, we're always fighting with bandwidth and being able to connect adequately. Dushan, if you come back and can unmute yourself, just let me know and I'll hand everything over to you. So the idea here is that we are going to apply all of these principles to an epidemiological unit. Now think of oh, I see that only the host can unmute Dushan. If Dr. Duhu, if you would unmute Dushan.
Okay, I hope you can hear me now. The problem was that only host was allowed to unmute me. So if I mute myself, that's one thing, but I cannot reverse. I apologize for this.
No problem, no problem.
So as they were saying, we went through these applications of the concepts in several different occasions, probably in the last 15 years. I would say 10 or 12 times we have been talking to the audiences. We have been going through different sets of exercises together as a benchtop. And then we finally went into an actual farm that was used as an example in our workshops to show to the colleagues from government, from veterinary services, from the aquatic animal health professional services, and most importantly for the producers as well, on how to apply these concepts that are unique to each epidemiological unit. And they was talking about the concept of epidemiological unit and the principles that are common for any epidemiological unit. But when you try to apply them, we have to be very careful to be specific to each unit or farm and their own needs. So we need to capture site-specific elements in a biosecurity plan that is written, and that we keep the records that are relevant for this biosecurity plan and program that we have put down together as a team. So when you want to work on how to apply biosecurity in an epidemiological unit, you have to first learn or know something about your target facility. So in this example case, we are going to talk about the hypothetic tilapia farm that has no biosecurity plan in place at this moment. So it has reasonably high or very high risk of a disease outbreak. It has an annual production of about 1.5 million. It has integrated production, means that it sells and buys live fish, but also larvae, eggs, and fillets. It can sell them internationally, which is important because then it's a little different set of rules to observe. It also imports breeding stock and eggs, uses both river and groundwater, has about 500 visitors per year, and it has a number of about 50 employees. So we have to learn about this particular example farm before we start applying certain things from our concepts and principles to this particular farm. So first couple of steps in the process is, as they were saying again, you go back to the questions a farmer will ask about this, how to work on these questions through the formal biosecurity process or step, and how to document those processes or steps and be able to produce those records for the subsequent evaluation, certification, and auditing. So if the farmer comes down on this tilapia farm that we just met and starts talking about, okay, now I don't know which diseases are posing to me as a farm owner or the farm manager as serious potential hazard. The formal biosecurity process or step is to go through the usually semi-quantitative hazard identification and prioritization that will be an outcome of this hazard ID and prioritization will be the prioritized disease list. Now, when we have this prioritized disease list, the next question is, okay, is this disease list important to me? Is my farm at risk of these diseases? How much risk is there? And if I get this disease, how much it will impact my farm or my business? So we go also together hand in hand with hazard identification and prioritization. We go through the exercise of risk impact assessment, which then brings us to the record or document that we have already evaluated this disease impact potential. So, simply put, in this average tilapia farm, if we try to determine disease hazards and risks, that's the first step. We ask ourselves, or we ask together in a team of usually veterinarian or aquatic health specialists that takes care of this farm, the management of this farm, as well as hopefully a government or local government representative that is familiar with rules and regulations that we need to follow. And we ask which important diseases are present or can potentially affect this farm. And if you think about this in terms of epidemiological unit, we can expand this to this exercise to different levels, but let's keep it right now on the farm here. And the second big question, again, what might be the impacts on the farm? And we have to agree or not leave out many of those, but major ones that usually are present on the farm. Okay, if there is a disease, we usually have decreased production. We have increased costs because of the losses and the increase in medication control costs and so on. If we have the disease that is a problem more widely, Then we have negative product demand and price is going down because nobody wants to buy your fish when they're sick. And you have to lower your price in order to be able to sell them if you have approval for that based on the regulatory restrictions, because some diseases are really restricted in terms of regulatory based on national levels or international levels, while some other diseases do not fall under these strict regulatory restrictions. So when you walk through this exercise, at the end you create a prioritized disease list that is based on severity of this potential impact. And how does it really work? Because we probably have to look at the qualitative or the semi-quantitative risk impact analysis. The reason for this is that an actual fully quantitative risk impact analysis is a process that takes quite a lot of time, a very specific expert knowledge and set of skills that is usually not easily affordable by the farm, individual farms or smaller epidemiological units. These types of fully quantitative risk impact analysis is therefore, due to their cost and the engagement of highly skilled professionals, usually reserved for larger epidemiological units such as countries or zones where the impact of these diseases can be estimated at a national level. For the farm, however, it's usually enough or good enough to work on the qualitative or semi-quantitative types of risk impacts using this matrix that can be relatively easily applied. So on one side, you have the likelihood or probability of disease introduction to your farm or disease escaping your farm. And on the other side, on the top side, you have the consequence or potential impacts of, in either of those two sides, we have added a ranking. So if you have, for example, negligible risk, that would be meant as a 0. If you have a remote probability or a very remote likelihood of having a certain problem with the infectious disease, that number is then 1. And when you multiply, 0 times 1 is always a 0. So if you have negligible consequence or impact, whether this disease or problem is very likely to happen, with negligible consequences, your total risk is still 0. On the contrary, on the bigger side, if you have a catastrophic potential impact, such as killing all the animals in your farm, killing all the fish, or stamping out that is mandatory by the government because of the infectious and dangerous nature of the disease. And if this is even an unlikely event, so if it has the level of 3 at the unlikely event, you're still looking at times catastrophic risk weight of 5, you're still looking at 15 total cumulative number, which puts you immediately in the category of high risk, because high risks in this particular matrix is defined as the cumulative, as the number of the multiplication that goes from about 13 to over 20. And you can see that if you're likely to have a disease that has catastrophic impact, you're in the category of extreme risk, which is bright red. So when you go through this process that is more broad, you have to actually apply it to identified hazard and risk levels to this particular farm, okay? And in this particular case, we went through this exercise before the tilapia lake virus was very known, and we still don't know the full impact of tilapia lake virus. We know it's large, but in our case, the viral hemorrhagic septicemia was one of the diseases that was very highly problematic in many different fish species. And in this particular farm, if it was at the time of the United States, we figured out that this was an extremely high risk, such as endemic disease, or it was the OIE, national or state regulated, and it was lethal. So it had both extremely high risk level and extremely high impact in this case, and that's why it would be ranked as the top of the chart here. Tilapia also suffers from a couple of bacterial diseases, such as Streptococcus infection or columnaris infection, columnaris disease, which in each in their way, so it would be the Streptococcus infection would still have a high risk because it's fairly ubiquitous on a tilapia farm. However, it is unregulated and it has high morbidity but relatively low mortality. So the full impact on this one would be totally considered as moderate. Columnaris disease, on the other hand, is not usually found on tilapia farms, and therefore the risk level is reasonably low. So it's either exotic and maybe have high morbidity, but in some states, such as in the United States, we use this as an example again, in Mississippi, columnaris disease is state regulated because of the catfish industry. So not because of tilapia, but because of catfish. But it still falls under the set of rules and regulations that bring it up, even though the risk level is low for tilapias, the impact may be moderate because there will be some legal actions that are required to be completed if this disease is detected on your farm. And finally, we have the enzootic ulcerative syndrome that I'm sure many of you have heard about, especially if you're coming from the Lake Zambezi basin, river basin. This enzootic ulcerative syndrome has been a problem for some time. The risk is relatively low, but the impact is high because it's an exotic disease. It's regulated by the OIE, and even though if it has low morbidity and mortality, these regulations say the exotic disease has to be treated very, very severely, even including the stamping out methods. So now with this risk level versus impact, we have selected these diseases and ranked them on the list of priority of how to tailor to these disease hazards our further steps in the action. And with this list of prioritized diseases and identified and semi-quantified risk determinations, we now have to look at our farm setup and ask a couple of other questions. So where these diseases get in? How can they get in my farm, in my setup? And the process that we worked on this particular question is called the critical control point evaluation. And the outcome is the list of critical control points which we can correct. Not all critical control points can be corrected, but on those that we can do corrections, we have to identify them and put them in the document, which is biosecurity plan. Once we have these critical control points, or the points where we can do something about the disease that can come in or stop it right there at this particular point, then we have to discuss what can be done to prevent this disease to enter to my farm or to escape my farm if we already have it. So the first list is that we have identified the correctable critical control points. The second part is to mitigate, management, or remediate these risks associated with critical control points, and to provide a document or produce a document, how did we implement corrective actions on critical control points? Now, this language may seem a little bit more bureaucratic, but it comes down to a few simple things. If we determine critical control points, we have to look at the vectors for the disease, how the disease is transported by live animals, fomites, how the disease is transported by dead or inanimate objects, such as wheels on the truck or the nets or the boots for the person that's carrying them. Vectors may include other fish species that come from other places, personnel, equipment, our own animals that can jump from one pond to another, or maybe are carried from one pond to another during the process of movement, water that circulates around the farm, vehicles, and feed. So we have to take into account many different possibilities now for this disease to be carried in or carried out from the farm. And once we have identified or determined these critical control points, we can go back to mitigating them. So one of the simple things is, if your farm does not have a gate, it does not have an entry point where everybody will come in or everybody will come out, then you have to correct this. If people or buses or trucks can come from wherever into your farm, that's not a good point, because you're now having critical entry possibilities which are coming from different sides. So one of the things to do simply to mitigate these critical points is to have one road that is protected by the gate. It can be as simple as the piece of metal or wood stopping everybody to come in, or it can be as elaborate as electrified modern chicken wire type gate that opens automatically. But the point there taken is that you have to, in a way, mitigate this risk of incoming or outgoing by simply putting some type of a control checkpoint that can involve the gate, that can involve the foot bath, that can involve the sign-in sheet, so that you actually have a document in the biosecurity plan that you can confirm to your auditor that, okay, I had 75 visitors last week, and these are people that came in. A couple of them from producers, a couple of them from colleagues, a veterinarian, and so on. So when you have a problem of a disease outbreak, you can then go back to this list and try to check and see what was coming into your farm that might have been bringing you a disease. Further points are, hello?
Yes, not to cut you, but we have a few hands up, and I believe that they have some questions to ask based on the presentations that have already gone on. So I don't know if I can allow them to talk, and then just two of them, and then we can continue. Is that okay?
Okay, we can try to do that. Dave, then I would appreciate if you can come on as so we can start to make this as a more discussion-like event. Of course, that's always more interesting than talking to the people. So yes, sure, why not?
Why not finish this section, and then before we get on to the next section, and that will round things off, because some of the stuff Dusan will point to may answer the questions. So why don't you just finish this section?
Okay, just about critical points, or do you think to go?
No, just the process.
About the process. Okay. Yes. So it will be another, I think, about 6 slides. So maybe 6-7 minutes before we can get to questions, if that's okay with everyone.
Okay. All right. No problem. Go on.
Okay. So to simplify, so we have a very, or it can be complicated, of course, but in case of these, the example is a simple one. You have a road that's your critical control point because it's critical for the entry or leaving the disease with a truck, let's say, and then you have to mitigate this by putting the gate in and the ways of finding out who came in, who came out, such as the sign-up list. Then when we have these control points sorted out and we have these mitigations, we have to develop a set of contingency plans, meaning the question of the farmer in this particular case is, what should I do if disease gets in? What's going to happen? What am I supposed to do when I notice my fish dying, for example? And this part of the biosecurity plan is contingency planning, and the document that you have to develop from these is, of course, the contingency plan itself that contains in itself the isolation, the treatment plan, the depopulation plans, how to isolate or quarantine in between the epidemiological units. It can be as simple as, okay, I see my fish dying, here is the list of phone numbers I have to call right now. But if those phone numbers are not there, are not prepared as in the contingency plan, then you have a problem because you're delaying the time of your response in communicating or reporting a disease outbreak, okay? This helps also because in the contingency plan, when something actually happens, you have it and you use it immediately, but then you can find out, hopefully, what went wrong. So you can reevaluate and correct your critical control points based on the contingency plan estimates or problems that you have seen in the case of an outbreak of disease. How to recover from disease? What are the steps? If this is the disease that requires depopulation, or this is a disease that requires treatment or vaccination, this all should be in your contingency plan based on your development of critical control points and mitigating them, and the disease priority list that you already developed in steps 1 and 2. This serves to keep business going. I wouldn't spend too much time. The veterinary diagnostic, surveillance, and monitoring, this is now really more related to the developing a case about keeping your disease away from the farm. Also, current status of your farm. If any of these priority diseases are already there, and if they're not, how do I continue to monitor their absence? Or in case if there are already some of these diseases on the farm, how do I continue to monitor their presence on the farm? So we're talking about two things here. We're talking about clinical evaluation and diagnostic testing that we need to fulfill to see if there is currently now at this moment in time diseases on the farm. We have laboratory records, farm records, veterinary visits to support this one point or one segment of the time. And when you want to have the continuum of these moments in time, you have to do and develop the surveillance and monitoring program that would also be supported by the farm, laboratory, and veterinarian records and results. So evaluation and diagnostic testing, think of it as a single moment in time to determine if you have any of these priority diseases already on the farm or not. And then to continue these actions of evaluation and diagnostic testing in a surveillance and monitoring program that would give you an idea if something shows up or if something stopped being there, okay? And why is this important? Because you would have to have a solid information about the presence or absence of disease, okay? And Dave, I think maybe at this point, we could take some of the questions because if we go down to the auditing and certifying, that would be a little different piece of the story. So maybe the colleagues have been already asking about the previous set of steps. Okay, go ahead. Thank you. So we are ready to take some questions from a couple of colleagues. Just to say, we have about 45 minutes left for this webinar, and I will have to leave relatively on point. So Dave, I may leave you with a set of questions if this goes beyond 2 hours.
Sure. Okay. Thank you very much. So I have a couple of questions here that I would want to ask. The first one here says, these are my own. They are not in the Q&A. So okay. The first one, yes, I want to ask is that in Ghana, recently the Fisheries Commission has just recruited some very young, energetic veterinary officers. What will be your advice for them to stay relevant in the aquaculture industry in terms of biosecurity?
Are they already trained a little bit in the aquatics, or they're fresh out of school, more or less, as veterinarians? Do you have any background information on that?
No, I do not have any background information on that.
Okay, then my first advice would be to, if they're specifically assigned to aquatics, to aquaculture, they might need to get some education or continuous education done. Not only in the biosecurity area, but probably also in basic aquatic veterinary medicine types of education that can take anywhere from a few weeks to a few months to speed up their education on the aquatic veterinary medicine. And then from that point, we can then add on the specific biosecurity type of training that they could find useful for helping the farmer and the government to combat aquatic animal diseases.
Okay, yes. Then the second question here is that still in the case of Ghana, how do we get all the stakeholders in biosecurity principles implementing based on your experience? So what this question is trying to understand is that the farmer may want to implement some biosecurity principles at their farm. However, if a government official wants to visit the farm and the farmer wants to ensure that this government official goes through the protocols for the farm's biosecurity, since he is a government official, may think that he has the right to enter the farm at any time and anyhow. What would be your advice based on your experience to get everyone involved in implementing biosecurity principles?
Well, I can tell you my version, then Dave can tell you his, probably, because if I understand correctly, the big point that we are trying to do with this, it is not that we want to make things regulated and mandatory. This is a joint effort to improve everyone's lives, and that's what is the major point that I think we're talking about when we work with the IVBC programs of biosecurity and the training in biosecurity. It's not about what government will force you to do. It's about what the producer and government and the veterinary services will find together that is practical and possible in very in the focused response of an epidemiological unit, or in this case, the individual farm or the company. So I would like to emphasize that while we are using and implementing the international standards set by the OIE, that governments in many cases are required to follow, what we're talking about here is not something that would put regulatory pressure on the farm. It's something different from that. It's convincing that implementing basic biosecurity steps will help the farmer make a better product and earn more money. And that's not much more complicated than that. So it's a voluntary approach rather than forced approach. And Dave, you can probably add some or comment on this as well. Thank you.
Okay, yes. There is a question in the Q&A from Tosi, and she, I don't know whether it's a she or he, but the person is asking I think he wants to say, how is it possible to isolate the large fish unit, especially a fish cage unit, if contamination of diseases are observed within the farm?
Yeah, I'll answer that, but let me first address the previous question, which I think is awfully important. While we are not trying to dictate what must or should be done, and I've already emphasized that every biosecurity plan is somewhat unique for any farm itself, and in fact, any country. I use, by example, what we are trying to implement in the United States. And that is essentially a voluntary program. But once people sign up for that program, there are a few things that are required, such as reporting, ensuring that the operation is registered by whatever government agencies. The other important part of this is that through our training programs, and what we have attempted to do is when we set in a training program, we make a very clear point to the people we are inviting, so they will all get to understand how these things would work from their perspective of producers, any of the veterinary workforce, or that's veterinarians, paraprofessionals, lab personnel, etc., and government officials. And the objective that we set, and I'll explain a little bit more about how we run these workshops, is that after talking to them and on lectures about how all these different things might work, we break them into small groups, and we ask specifically people to either play their role as a producer, part of the veterinary workforce, or a government official in addressing the tasks that we have. And so what it ends up in is that together as a team, they sit down and work through exactly how they would go through each of these steps. So it is not, it's in a sense encouraging government officials to work with the producers, to work with the veterinary workforce members to come up with the best ideal, because the objectives of the government, as we pointed out earlier, are essentially the same objectives as the producers. So if we can get to something that is practical, economical, easy to implement, it's going to work. If it becomes just a regulatory effort from the top down, I'll simply say we've tried this and it just doesn't work. I mean, if government officials dictate, it's going to cause really great disruptions and not work towards the sustainability. To ask the other question, and this question was interesting because I saw it appear in the Q&A, I have tried to address some of those other questions that were asked in the Q&A. But the question is, how possible is it to isolate, let's call it a net pen that is in open waters as a epidemiological unit, each net pen. Now, earlier I did mention that we've run 2 of these workshops in Norway in previous years. Norway's salmon industry essentially are net pens in groups and different farms scattered throughout the northern borders of Norway. And we ran operations. In the simplest sense, each net pen can be identified as an epidemiological unit, unless they are sitting, well, even if they are sitting, let's say, right next to each other, they have a simple net dividing them. So technically, they are separate epidemiological units. Now, I will say that there are some situations in which trying to isolate and prevent movement of infectious agents between these epidemiological units is more difficult to others. But we've got to a point in the presentation which I think is identifying what's there through clinical diagnostics and lab, clinical and lab diagnostics. But do realize the biosecurity status, or the status of disease, depending how well isolated, can change over time. And it can change because infectious agents can come through in any different ways whatsoever. What we have found, though, is if one looks at an individual farm that may have several net pens that are in close proximity, effectively, if monitoring of those for whatever diseases one selects you use that as a single epidemiological unit. And if something breaks out, for instance, infectious salmon anemia, when we've done this in Chile, where salmon is big production, and Norway in workshops, your contingency actions are then on that group of farms considered a single larger epidemiological unit, or technically it may be in more than an establishment, but what the OIE calls a compartment. So they do work. And the other thing to realize that, and we'll explain it in a few slides coming, that you can get we're proposing that there's a progressive stepwise thing on certifying farms, and realize that, boy, if there is an outbreak, you may back up to a lower level. So I think that's coming. Hope that answered the question.
Yes, yeah, thank you very much. I think there is an interesting question here too that says it is very difficult to pick some infected fish from the cages for treatment and avoid eruption of the disease to other parts of them. What can be a right and simple way to treat the infected fish in a large fish cage unit in the lake? I think this is also similar to the first question which you have just answered. There is a question here that says, I work in the insurance industry in Ghana. Is there a training program designed for insurers to help understand what to look out for in terms of biosecurity?
I'll answer that one too. Yes, okay. The bottom line, and we have given presentations at international insurance meetings previously. The bottom line to this, insurance agencies want to minimize the risk. They need to be able to calculate the risk of certain things happening. What we've seen from these international conferences that we've attended, disease is number one risk. Now, there are perils such as, let's say, storms coming in, demolishing net pens or destroying things, or earthquakes and stuff. But just keeping to the diseases seem to be number one. And what we have simply said is to minimize the risks from the insurance agency's present perils is to ensure that the operation has some level of biosecurity, that they are doing their part to maximize the biosecurity. We may or may not get through and make an emphasis here, but from the government's perspective too, if through this whole procedure, the operational or the epidemiological unit or farm can document evidence that they are free of disease A, B, and C, they don't have to do all of the testing that's needed for sending out. That certification can also be used by the insurance agencies. Are you certified? What level of biosecurity is certified? And the insurance agencies can therefore decrease their premium costs according to how well this particular operation is protected. So the answer is there's a very good role for the insurance industries to assist with this. I will say that what we found was we had some of these meetings in Turkey, and what we did find was the industries in Turkey actually provided coverage for, and using independent insurance companies, provided for basic protection against diseases, provided the Turkish producers actually implemented some level of biosecurity. If they didn't, then the government wouldn't assist them in obtaining insurance. This question about insurance is certainly something that we need to expand on. Hope that answered the question.
Okay, yes. Olufemi says, my university would like to establish collaboration with the presenters. I have been involved with teaching, research, and okay. So Olufemi, I think we will share the contact of the presenters with you. Then you can have discussions with them. So I think Dusan, I think we should continue with our presentation. Okay. Then we have a few, I think about 30 minutes to end. So we will continue with the presentation. And once that is done, we can continue with the questions and then answers. Before that, we have 2 hands up. So when, after your presentations, these 2 people would ask their question, and then we can continue with the Q&A. Thank you.
Thank you, Dr. Dudu. I also saw in the chat function that there was a comment by one of our colleagues that since this is more specific to Ghana, and most of the aquaculture in Ghana is related to tilapia cage culture, that we might try to use some examples as we go along that would be more familiar with it. I would try to leave this as a part of the stuff, because we cannot really address all the stuff. So what we're talking here is talking about principles and how they're applied specifically to certain aquaculture operations. I can try to shift a little bit and use it more in a cage, but we're at a point or stage now when we have to start wrapping up this talk about the applications, and then David will take over with a little bit more about what the next steps would be. And I hope that this will also be served as a starting point rather than just finishing up. I also noticed that our colleague from the FAO, Melba Rantasso, Dr. Rantasso, was joining, and if she's still around, hi Melba, good to see you again. There will be some activity regarding specifically tilapia production and diseases of tilapia production that she mentioned in the chat function that she asked our host to disseminate further. So that might also be a way to learn more about focused problems of tilapia cage culture in Lake Vaname. I'm sorry, I hope it was mentioned. But in this particular case, I would like to just continue and try to give you an overview. So by this point in time, we have studied or said that we can prioritize diseases. We have to have a prioritized disease list. We have to identify control points and mitigate them. We have to come up with contingency plans on how to address stuff that happen, really. And to help us with this, addressing the stuff that happens, we need to have information of what is in there, such as diagnostics by clinical and laboratory. And the step after that is to provide continuous monitoring and surveillance of these events, disease events that might happen. So identifying what's there, we have to have appropriate veterinary clinical evaluation and sampling and confirmation by the diagnostic lab, followed by the full epidemiological evaluation and interpretation of these diagnostic results. And I cannot really emphasize this enough. Finding a PCR molecule-based information does not equal a clinical disease problem. So you can find a lot of genetic evidence of presence of different pathogens, but that does not mean that all of them or even any of them is involved with your particular clinical problem. And that's a completely different topic to discuss, but just kind of a, I have to say this because I frequently see misinterpretations of the value and the correctness of only molecular disease information. So if we go then to the next step, so we figured out what is on the farm or what is not on the farm from our prioritized disease list. Now we have to develop a program for surveillance and monitoring to do periodic disease presence or absence evaluations. These change with different conditions on the farm. So, for example, if you didn't have anything coming to your farm for a year, and you have been living in a closed environment such as recirculation aquaculture system, there may be no need for every month going into evaluating disease presence or absence. However, when you're working with an open system such as a cage farm of tilapia culture in a lake that's shared environment, you may need to be more frequent in these evaluations of disease presence and absence. So do we have fixed time intervals, or do we increase the intervals based on the outgoings? For example, you know, or you've heard that some farms 10, 15 kilometers away still have, or they emerge with disease problems. Does that mean that your farm wants to now increase these intervals of disease checking or not? That's again up to you or up to your veterinarian and so on. But it's the same process as the diagnosis of the disease. So you have to have a veterinarian clinical evaluation and sampling of all populations of interest, confirmation in the diagnostic lab, and then interpretation of those diagnostic results. And with this, I think Dave is probably more suitable to go into more details on resources that we all know that are probably scarce in Africa, but he can give some examples of how these resources have been figured out in the United States, what is information that's already available globally, and how African nations can tap into these resources. Thank you, Dave.
Yes, certainly. I'll just quickly mention here, when we're looking at the personnel and resources, you will realize that the two most critical things that need to be put in the country is, how do you find these people that you can help? And where are the diagnostic labs that can perform this? These are obviously some of the things that have to be in place. I mean, these are very critical. This is just an example, and I'll get later into some other things. A number of years ago, I want to say about 2010, maybe a little earlier, we were asked by OIE at one of the aquatic animal health conferences to put together a presentation on, you know, how can we improve health certificates, or what we call certificates of veterinary inspection, and a variety of other things. And one of the things that we had set up with a small grant from USDA Risk Management Agency, and I won't explain too much, is this aquavetmed.info database. And we needed to have something which producers could actually locate people that could help them. Unfortunately, in 2015, we did not have any money to revamp this directory. But I've just illustrated on the right-hand side a system that we've got in place, which we refer to as NALN, or the National Animal Health Laboratory Network. These are all labs throughout, the diagnostic labs throughout. Some are federal, some are university, some are state, but there's a network of communications for that. These two things, diagnostics and a lab situation, and the people who use it, are critical for any response to animal diseases. If you give me the next slide, I'll just continue on this.
Sure.
Okay, let me just quickly go through this so we jump into the next session. The key on trying to determine what the status, or really the ultimate goal, the real true endpoint, is to be able to certify that epidemiological units are free of whatever diseases are prioritized. These can be OIE, and they can be non-regulatory diseases. Things like Aeromonas or Streptococcus, which sometimes cause catastrophic things. We can apply the biosecurity processes to this. So it doesn't have to be regulated. But the two critical things there needs to be somebody who is overseeing it. We mentioned veterinarians here because veterinarians particularly, if they don't do things properly and according to veterinary ethics and principles, they potentially can lose their license. So there's important things here. It's the veterinarian or the person who is doing the auditing and monitoring all of the published or all the records and evaluating there that has the responsibility of actually doing the initial creating what we call a certificate of veterinary inspection. In the general parlance of OIE and others, people refer to this as a health certificate. I'm not going to go through why we are careful about all the details, but it's a legal issue. If a person says this animal is healthy and it breaks with another disease that they haven't looked at, there's legal implications on whoever does it. So it's better to refer to these as something that is certified that they have been inspected for specific diseases. Now, the important part here is to get more, even greater official recognition. You leave the endorsement of those certificates of veterinary inspection to the government agency. And I think you see now why you need collaboration for the producer, the veterinary health workforce person, and the producer all working together collaboratively. We're going to have the next slide. Okay. We look, and just very, very briefly, we look at differences between auditing and certification. I think this is fairly obvious. Audits are just checking that things are in place, where certification is somebody's putting his neck on the line to say that these things, in fact, I certify that, boom, boom, boom. In this case, that the process evaluated everything, what level of biosecurity, and the disease status. We could have the next slide. And if you would go through the progressive steps here, because I think we've broken it down because we realize that all of this stuff can be put in place if people have prepared stuff before fairly quickly. But if they haven't, it may take them a while to get the biosecurity written plan and go through these. So what we are proposing is 5 levels of biosecurity, and it breaks down. And if you go through the next slide, or the next maybe couple of slides, you'll see that what we've proposed here is biosecurity level 1 encompasses the first 2 steps to the steps 3 and 4. And if you give us the last slide, you'll see that we've still got all of that. So this could be a progressive thing that can be implemented in any country or any jurisdiction, and with the assistance of the government. And I think fairly straightforward. Okay, let's go to the next thing. Dushan, would you like me to just finish off with this last portion?
Yes, please. Yeah.
Okay, so what I'm going to talk about, and the idea here is how if we approach this, and if there is an interest in, let's say, in Ghana or in any other country of implementing any training workshops or variety of things, that we give you an idea of what we think that needs to happen. Okay, if you could go through the next slide. Okay, I'm trying to synchronize some things here. We've got a very simple philosophy, and we've used this philosophy in all of our training workshops, conferences, and everything else. There's just some of them, and that is, it's more important to show people how to do things and let them try than it is to just give a one-time lecture and say, well, you know, you got to learn that. This stuff needs to be repetitive. And so, you know, I pull on old Chinese proverbial things in this particularly, such as, you know, what's presented there. You know, Confucius says, tell me and I will forget. Show me and I will remember. Involve me and I will understand, and step back and then I will act. So we've tried to use this philosophy in everything that we can do. If you give me next slide. You know, click again, because I think there's two parts here. Some of this I have emphasized before. If any country, region, zone, or whatever needs, one of the things that you need is veterinarians that are licensed and accredited to be able to act on the behalf of the government. And then all of the personnel that make up this veterinary workforce, you need the diagnostic lab system, you need the standard process for the education, compliance, and so on. And certainly you need government infrastructure. In other words, what we're alluding to here is there is going to have to be a government or a private-public partnership. This is not going to happen either by the government alone or the industry alone. The government and the industry have to do it. And again, the two most critical things here are being able to find the people who understand how to implement these things, and diagnostic labs. If you can give me the next slide. Thanks. Some of the key on this here is what these individuals might do. These obviously each of them have different roles. You know, the industry, the owner and employees, they need to write this stuff down and keep records. The accredited veterinarians, and I believe we've put in a few slides here to sort of explain some of these accreditation programs, which I'll get to later, may be extremely useful. Obviously, all of the other parts of the veterinary workforce, vet techs, nurses, fisheries biologists, that assist in all of these things, and then the government official. And the government official overseeing all of these things, I think, is awfully important. Next slide, please. Okay, here's really and truly, and I think I've explained this previously, we try and, when we've run these workshops before, we try and make them as hands-on as possible. We spend one day just talking at people. We spend one or sometimes more than one day with actual tabletop exercises that we let these teams actually go through and solve the problem. And then we go on to a farm the next day and we say, okay, you've learned all this stuff, you've practiced it. Now, here's a farm for you to evaluate. Tell us what you think needs to be done. And I think the message then gets through and really bakes in. Some of the things that we certainly under IVBC want to do is try and have some means for determining whether trainers, individuals are competent, both the veterinarians, the people that are involved, and be able to say, look, this person has gone through appropriate training, testing, and so on, and is there. But we'd also like to see, and we would need help from the government agency, I believe, or at least a coordinating board such as the council, the Ghanaian Council for Aquaculture, that could recognize farms in the country that are implementing biosecurity programs. This would be exceedingly helpful and go a long way to getting the whole country sort of working on the same approach. Next slide, please. Okay, I'm not going to belabor this because I mentioned it previously. We need some sort of certificate, official certificate. These are a whole wide range of certificates of veterinary inspection. The large one on the left is from a publication that we put out, gosh, I think it was 2003, on the ideal things that need to be in certificates. But as yet, there still needs to be a certificate very, very specifically tailored for what's been done on an operation in terms of biosecurity. We can have the next slide. Okay, I'll mention this briefly. I'm not going to go into too much details. There are several systems to expedite these electronic certificates of veterinary inspection. Simply to say there are several countries, most notably the United States, Europe, Australia, New Zealand, and a few other countries that have expedited creating a certificate of veterinary inspection to allow shipments to move from one place to the other, such that the veterinarian, after inspecting and taking samples, submits them to the diagnostic lab. The diagnostic lab then sends them back to the coordinating, usually a government agency, to enter into a certificate. That certificate can then be printed very quickly for the producer that is shipping, and that certificate then that says these animals are free of A, B, and C or whatever, or these diagnostics have been done, can go both to the regulatory agencies, the sending regulatory agents, the receiving regulatory agencies, the hatchery or a farm or the processors or the natural resources. So these systems are in place. They do take a lot of IT programming, but what we're trying to get to here is that they, once set up, they can be easily done and fairly inexpensively set up. We can have the next slide. Okay, here are some things that we think are probably needed for, if anything is to be done in Ghana or any other countries. I'll move through them very quickly and then summarize things, and we'll leave the few minutes left for Q&A. Suzanne, if you can give me the next slide. This is just some examples. I'll say right off the bat, government agencies simply do not have enough personnel to help. These veterinary accreditation programs have been set up to actually help build the workforce within the veterinary profession and the government agencies to be able to help implement a lot of the things that are needed. The three examples that I put up here are in the United States, Canada, and Australia, New Zealand. In the EU, they don't call these people accredited veterinarians. They refer to them as official veterinarians. The important part is that this actually supports the PVS tool. PVS is essentially the performance of veterinary services within a country. We can have the next slide. And this is just by illustration. Okay. this is really what we've implemented in the US. It's been going for a number of things. The USDA Animal Plant Health Inspection Service, APHIS, subcontracted with the Center for Security and Public Health at Iowa State to develop a lot of information. These do contain aquatic animal issues. All of these are actually provided to every veterinary school in the United States. The manuals and the publications, they are also web-based and classroom-based, and they're also available in other languages. But they set essentially the bookwork and things that are necessary. Susanna, next slide, please. And this is just as illustration. In the online training, we have 29 modules currently. I will say that about somewhere around 15 to 18 of the ones that may have different titles are all applicable to aquatic animal health. I emphasize here, these are free for everybody to go through, irrespective of where you're from, okay? And there's a link at the bottom that you can look at later, but you'll notice of the 4 that are specifically identifying aquatics. Module 15 deals with disease prevention biosecurity and actually utilizes, but has a slightly different approach to most of the things that you've heard in this presentation. If you can give me the next slide. Okay, just to summarize where we're coming from here. These, again, are the critical parts that effectively need to be focused on, okay? That an appropriate biosecurity plan or implementation will look at, first of all, prioritizing the disease hazards and risks. It will look at critical points where diseases can come in or get out. It will look at mitigating action to fix those if they do come in. Contingency plans that if one gets an operation or an epidemiological unit or farm gets infected, there's some preparation for how we're going to respond. There will be a necessity here, determination over time of the status and freedom for those specific diseases. There will have to be continual progress in monitoring and auditing, and hopefully the ultimate goal of certifying that this operation or epidemiological was free of disease can be accomplished by the government. And if you give me the next slide. We have provided one of the chamber personnel can probably upload a document that has all this. You may not be able to read it, of some publications that we would recommend that you go and read, which will give you more details of a lot of things that we've got. And also, if anybody, hopefully all the registered participants will be able to get a copy of this presentation to be able to review at a later time and actually use some of the links that are in there. So if you give us our last slide, I think we can open it up for any last minute questions.
Thank you, Dave. I would like to just say also that if you have further questions that are not addressed really today or right now, you can definitely use the email that's right here. It's ivbc@vetmed.lmu.de. That would be reaching both of us directly, and also, of course, through our hosts, the Chamber of Aquaculture of Ghana. Please ask them. They can forward the questions to us if they cannot address them.
Okay. There was another question came in on the Q&A. Would you like to pose that? Collins?
Yeah, it's from Ramadan Saliman, and he's asking, how do you involve the question of One Health approach as a strategy to contain issues pertaining to disease transmission in fish farms?
Dushan, do you want to start?
Well, it's simple. We don't. So One Health approach is considered much broader than what would be related to the very specific problem of disease transmission in fish farms. So if we're talking about politics versus actions, that's the way I would look at One Health approach. It's benefiting everybody in terms of very distant relationship from the from the moment in time when you prevent disease transmission within a fish farm. Then of course you're making this better for the producer, you're making this better for the fish welfare, the fishes are more healthier, you can sell more of fish, people can eat more, they guys earn more. So it's very several steps removed how this One Health term is really focused on this. However, let's not let's not use this as a way out or easy way out, because when we're talking about antimicrobial resistance and issues that pertain to disease transmission in fish farms, is that we have to use some tools in order to prevent or stop disease transmission in fish farms, which involve use of antibiotics. And in this particular case, we have more direct effect on the human health, because if we use antibiotics incorrectly, if we use them illegally, then we're getting a problem there that can influence people in terms of humans as well as animals on the same way. And that is a real One Health problem that we can work on.
Okay. Yeah, thank you very much, Prof. I would now give the opportunity to Nelson Agbo to ask his question. So Nelson, please, if you can hear me, you can unmute and then talk. Okay, so if Nelson is not available, Charity, please, you can unmute and then talk and then ask your question.
I think, sorry, to Professor Dudu, I think the host has to unmute anybody. It was the same thing with me. So if they're muted, the host is the only person who can invite them to unmute.
Yes, actually, I have given permission to those who have their hands up to unmute and then talk. But it looks like their hands have been up for very long, and I think they have forgotten that their hand is up. But there is a question from Olufemi, and she's asking, do we have transboundary diseases that are of public health importance that we can focus on?
I'll attempt. The answer is very simple, yes. There's a number of food safety problems that we've got. It would be just not worthwhile to start listing all of them. There also are very few zoonotic diseases that are important that get transmitted from animals to humans or vice versa, at least aquatic animals. So I think we're lucky in that aspect. To get to the One Health question a little bit more too, One Health is evolving as an important thing. There's three pillars to One Health: animal health, human health, and environmental health. And it's probably much bigger than just the aquaculture biosecurity. but you can see very quickly that you know, any food safety or seafood safety issues or diseases are going to impact humans as well as all sorts of things. Any diseases that are escaped from an operation or come in from the environment, which is usually the source, or it is one of the major sources for many diseases, it links to the environment. So the One Health concept is pivotal to keeping in mind that the environmental issues and human health safety issues that need to be addressed.
Okay, yeah, I think Nelson's hand is up again. So please, Nelson, if you are available now, you can unmute and talk, ask your question. Okay, it looks like he's not available. But Prof, one question here from myself. At what level should biosecurity be taken more seriously? Is it at the national level, at the farm level, or at the regional level?
Oh, so this is a good question. My immediate answer is all of the above. But the question really, if you put it in, and how can all of this be implemented? Okay, and irrespective of what happens, I would simply say there has to be political will from whatever stakeholder group you've got. In the one, our approach here is that, you know, we think there's three general stakeholder groups: the veterinary workforce, the government agency, and the industry. You've got to remember the squeaky wheel gets the grease. So if industry starts saying we have to have blah blah, sometimes that helps. But I think what's important is, what's more constructive is if the three groups, and if you just use Ghana for example, get together and start talking about it. Look, this is important. Our industries and our country is at risk for catastrophic things. And Ghana has already had a few little catastrophic things that have happened. How can we prevent this happening together? Let's sit down and see if we can work out a plan. It's, you know, what may be the best way to do it. And I think by sitting down and really educating or training all three stakeholder groups together and insist that they work as collaborative things. Personally, we have seen, and I also honestly believe that that is the most practical way to go. So again, it's all of the above, and
Okay.
but they've got to understand how, you know, what is the best way to really implement it for their benefit, for their aim.
Mm-hmm. Okay, all right. Thank you very much. I think on taking a check on our time, we have exceeded our time by 6 minutes. So I think, Prof, thank you very much. And Prof. Dusan, Prof. David, we are very much grateful for taking time out of your busy schedule today to be with us, to share with us your wealth of experience concerning biosecurity principles in aquaculture. I believe if we should allow ourselves some time, we would continue to talk and talk and talk and talk and talk. But this is how far time would allow us, especially for today. We believe that we would have other webinar series, and if we have more time, we would have our next webinar come next year. So just a quick announcement, our next webinar will be in February 2022. However, for biosecurity principles in particular, we are hoping that we will be able to organize training workshops for trainer of trainers, and even for the entire stakeholders, as Prof. David puts it. So we are hoping that we would be able to get some funding from corporate organizations, so that in February, when we are calling on you for the next training on biosecurity in principles in aquaculture, it will not be an online event, but it will be a face-to-face event in Ghana. So we are asking and we are calling for corporate organizations to support the Chamber of Aquaculture financially to be able to organize the next biosecurity webinar on a face-to-face basis. Thank you all very much for your time. Thank you for being around for the last 2 hours. Thank you for your questions, and thank you for listening in. We are very grateful, and we hope that the next time we call on you, you would not hesitate to respond to our call. Prof. David and then Prof. Dusan, thank you very much, and may God richly bless you. Have a very wonderful day.
Thank you very much.